So those are direct ways of transmitting infection. Okay. Indirect transmission often caused by contaminated objects termed a vector or a fomite. Okay. Those items include insects. You know, we know insects like birds, not even just insects, but anything that can transfer back infection. Like when we had the bird flu or insects, what were they carrying? Remember we had the Ebola deal about 3 or 4 years ago.
H5N1 virus.
Yep, you know, that virus right there, H1N1. You know, so those are types of vectors are fomites. Same thing, includes insects, food, water, drinking glasses, computer keyboards, infected medical equipment, and any object could be an indirect. So if I sneeze in my hand, bang, I grab the door handle, Lauren comes and grabs the door handle after me. It wasn't a direct transmission, indirect, because she got it from the door and not me per se. So that's why when I go to my rooms, guys, I clean up everything. I clean up the door handle because, like I said, somebody else has been using that room for 8 hours before me. I don't know how clean that person was, right? Not to say my coworkers aren't clean, but you always want to, just like when you go to the ultrasound machine and you press, transducer, you press abdomen again, you always want to go with a fresh start. So that's why I don't go in and just start touching stuff. I'm going in to clean up first, and then, I'll start working. Okay? So it's important that when you guys go to clinic, along with you helping that technology get their room together, filling up the room with linen and whatever it needs, definitely clean that room. It's not just for the technology, it's also for yourself. Because I'm telling you, you don't know. I can't tell you how many times I go in there and people have gel on all the transducers. I don't know what kind of exams they did before then. Or like I said, some people, wear their gloves outside the room. Just got finished doing a patient, bang, they walk into the office with their gloves still on. In that case, I'll tell them, hey, why you still got, what's up with those gloves? I'll let them know because I'm not trying to take nothing home. So, there's just many ways to get something, including, that's the indirect way with indirect transmission from a vector or a photon. Okay? Sonographers can break this cycle of infection by practicing medical asepsis and using proper disinfection techniques like we do, like using the tea spray on the transducer, washing your hands. Those are ways that we can minimize infection control or minimize the spread of infection. Jasmine, you had a question? Okay. So aside from being immunocompromised or immunodepressed, some other susceptible hosts include children with immature immune system, like young children who haven't really developed a strong immune system, cancer or diabetic patients, okay, people with poor nutrition, and people with poor hygiene. Okay? They tend to carry a lot of bacteria and infection with them. Okay? So once the pathogen enters the body, there are 4 stages of development. Guys, know these 4 stages. That's table 12.4 in the book. Okay? So the first stage would be the incubation stage. That's when a pathogen enters the body and becomes dormant. Okay? Eventually the person will start to exhibit symptoms of the disease. Alright? Okay? The second stage will be the prodromal stage. That's when the disease becomes highly infectious, and explicit symptoms are abound, or you notice explicit symptoms. Okay? Stage 3 is when the person has full disease. The disease reaches its full potential and remains very, very infectious. Guys, however, all diseases don't provide symptoms, but they still can be doing damage to the body. All right? And the last stage would be the convalescent stage, and that's when the symptoms dissipate. However, some diseases like herpes or TB can go through a dormant period, but then they can return again to produce symptoms again as well. Because like a disease like herpes, you can't get rid of it, right? You can only treat that disease. Okay. TB, you can cure that. All right. So let's talk about nosocomial infections. Nosocomial or hospital-acquired infections. That's what nosocomial means. Okay. Without proper infection control, patients may contract nosocomial infection. God, it's a big deal in healthcare because it's been a real big prevalence of this in Harris Health over the past, I'll say, about a year. I think about all of those babies that were contracting, they were getting sick from somebody. Somebody was passing along sickness, and all the babies in the NICU were getting sick. So they ended up closing the NICU up so they can, clean it up real good before they brought the patient. That's why a lot of the babies were all at Bental for a while. Now they're back over there, but now basically to get in the NICU, the NICU, you basically have to take a bath to get in there, and somebody's outside monitoring you while you're doing it. So when I come up there with my machine, the first thing I'm gonna do, you have to get like you going to surgery, open the pack with the scrubbers. You gotta scrub under your nails, scrub your hands all the way up to your elbows, and you gotta clean your machine out. Even if you just cleaned it out before I came upstairs, you have to clean it off in front of the people and the NICU. Okay, so it's a big deal with nosocomial infections, and they're really coming down hard now. So there are 3 contributing factors to nosocomial infections. One of them is the inability or non-compliance of healthcare workers to follow infection control guidelines, i.e. not washing your hands. Okay. Another one is the increasing number of drug-resistant pathogens. Okay. If we don't have the drugs to fight it off, then it's just going to keep multiplying, right? And we're going to talk about one of those shortly. Okay. And increasing number of immunocompromised patients. Just, patients with not a great immune system. Okay. Especially here at Harris Health, because a lot of time our patients come to us with, they're already immunocompromised because they come to us well into the disease process. A lot of time our patients, we don't get those patients that, have the most resources or can take a day off from work at any time, where I can go to the doctor. So a lot of times we get our patients, they're like stage 3, stage 4, up to cancer, or they're really bad off. Okay, so according to the Centers for Disease Control and Prevention, the most common nosocomial infections in the U.S. have been grouped together under the heading of healthcare-associated infections, or HAI. I'm on page 326 in the book, guys. Okay. So some of those common infections include central line-associated bloodstream infections. Okay. Not taking care of those central lines after a while. Those, we even have to do ultrasound on central line placement. Look around there to make sure it's not any growth or any plaque or any kind of anything going on with that line that they're using for central line placement. Okay. Ventilated associated pneumonia. Probably from not cleaning these things properly. Guys, those 2 things right there, both ventilator-associated pneumonia and central line bloodstream infections, result in billions of dollars in treatment and thousands of preventable deaths each year. So nosocomial infections, everything is preventable. If everybody was doing what they're supposed to do and they weren't doing these 3 things right here. Okay. The most common nosocomial infection, though, guys, would be a UTI, a catheter-associated urinary tract infection. That's the most common nosocomial infection or healthcare-acquired associated infection reported. Okay. UTIs are associated with long-term use of indwelling urinary catheters and can result in treatment of improper care. Remember last week we were talking about, making sure that that urinary bag is below the patient. Because if you happen to have the urine backstream into the patient, you're putting bacteria back into the patient that was expelled out. So you're assisting in the nosocomial infections if you do that. So always remember to keep that urinary bag down below the patient. Okay. And those are the most common types reported. Surgical site infections are also a big big hospital-associated infection. Such as when people come back after, gallbladder surgery, they usually have 3 points of entry, and sometimes those little sites can get infected if they're not taken care of. All right. So, guys, let's talk about some different diseases that are more susceptible to sonographers getting exposed to. Okay. such as MRSA, which is methicillin-resistant Staphylococcus aureus. Infections they're a big problem in healthcare because those strains of bacteria have become resistant to medicine. Okay? So a lot of times you have an MRSA patient, this is simply, you're gonna have, that's contact precautions. You're gonna, when an MRSA, you're gonna have everything. You're gonna have your gown on, you're gonna have your mask on, your cap on, everything when somebody's MRSA, because because you're basically protecting them, right? Because you don't want to give them anything that you have. So it's kind of like a reverse deal. All right. Okay. Patients prone to these infections include those in nursing homes, on dialysis and intensive care, and on extended hospital stays. Okay. Patients who appear healthy and healthcare workers can spread MRSA easily. 1 in 3 people carry staph in their noses. 2 in 100 carry MRSA. God, that's pretty common. That's a lot. That's a lot. So definitely do your best to protect those patients. So when we're getting dressed up and we're following our standard and universal precautions, we're protecting that patient. Okay? Let's see what we're talking about. So the next one we got is Vancomycin-Resistant Enterococci. So bad for you guys on Thursday. We're gonna have hopefully I have time to do a nice review. I hope so, or give you something to review. All right. So Vancomycin-resistant enterococci. This is a normal type of flora that can cause an infection if it enters the blood, urine, or a wound. Okay. Because whatever I have on here, this is what's important. I would say important to know. Okay. Vancomycin-resistant enterococci. That's also abbreviated as VRE. The patient on bedpans can easily spread this bacteria. VRE may be resistant to normal hand washing procedures. Okay. VRE is the second most common microbe to cause nosocomial infections. A person with VRE, we're going to implement our contact precautions, meaning we're going to have on our gown when we go deal with this patient, because we're possibly gonna, because that patient touch us, we possibly can get this. All right.
CD.
Some other pathologies we're exposed to would be Clostridium difficile, or just abbreviated as C. diff. Okay. C. diff is a spore-forming bacterium that releases toxins into the bowel. Okay, it's usually spread by means of casual contact via healthcare workers. Okay, it is resistant to disinfectants and can be spread through casual contact. Long-term antibiotics destroy. Oh, so real quick, you can I know somebody who had C. diff before. It can be really bad. It can be really bad diarrhea, from normal diarrhea all the way up to from watery diarrhea for several days to bloody diarrhea. This person happened to be out for a whole month dealing with C. diff. So it's a big deal. I don't want and I was at Herman when that happened, and everybody else had to go get tested in the department for C. diff to make sure that everybody else was good. Okay. The disease can progress to more severe stages, resulting in bloody diarrhea, dehydration, and abdominal cramping, fever, and leukocytosis, or a high white count. Okay. It can lead to, so people who are susceptible would be somebody with long-term, who's taking long-term antibiotics, because you destroy the normal flora in the colon, and it can increase patient susceptibility because you're killing the good flora in your body, and makes you more susceptible to having disease. Okay. So our next disease up is tuberculosis. TB. It's a chronic recurring disease caused by the Mycobacterium tuberculosis and Mycobacterium africanum bacteria. Okay. Though most individuals with TB can affect the lungs, referred to as pulmonary tuberculosis, It can also affect other parts of the body, such as the spleen and testicles. Okay? It can be asymptomatic, also known as clinically silent in the early stage of the disease. If left untreated, it can really do damage to the body. Okay? Many healthcare facilities require the use of special respirators, guys. Our respirator would be what? N95, right? N95. Hopefully everybody got tested. Everybody had the big bag put over their head and they sprayed some stuff in there. Did you smell it or not? Okay. Or did you taste something sweet or not? I think that's what she asked.
Sweet.
Many sonographers in the patient care setting, not only sonographers, everybody, are required to have routine purified protein derivative skin tests. That's what the TB skin test is called, a PPD skin test, yearly. So just like, especially it's on your birthday month. So my birthday month was last month. I just got my TB skin test like last week. I shouldn't have waited that long, but I did. I hate getting those. I hate putting something in my body that I don't want it. You know what I mean? Like even getting the flu shot, I hate getting it because like you never gave my body opportunity to fight. I still feel like, my immune system's good. And I hate when, you read, if you guys ever read all of the stuff that is in the flu shot, y'all ever read that, like pig products and all kind of just,
Pig?
Yeah, like pig products, yeah. You ever
Me
read?
and my husband, we never take anything from.
Well, you eat pork, so.
Well, you can
Except
do it. I
to
can't do it.
Yeah,
I can't
except
do
when
it.
I start school. I
Same
take all
thing.
this stuff.
But
He
still
doesn't
do
believe
it.
this.
That's my choice. That's my choice. I don't want, like, you can be, what you call it, suspended indefinitely if you don't get it. I've been suspended indefinitely
Right.
for like
Too.
4 days because I was trying to figure out a way to not take the flu shot. Because at first, I'll say about 6 or 7 years ago, probably longer than that, it used to be optional. Or you can just wear a mask in a hospital. But now it's no longer optional unless you have like a religious reason or some kind of special reason. You have to get it. So, I always wait till the last opportunity, I guess. So yeah, that's my choice, dude. It should be. It should make me do that. But I don't want to lose my job. And so you suspended indefinitely. I don't come back. Don't come back.